back one more time, still talking about imaging parameters, but this time we're talking about how to minimize your scan time. And down here I have that it's the most important. This can be the most important for your patient because, one, your patient could be claustrophobic and they could come out of that scanner at any time. They could choose to end their scan, and the faster you scan, the better the patient is off because the more sequences that you can complete and send to the radiologist. Another reason why scan time is so important is because the longer the scan, the more opportunities the patient has to move around and cause motion artifact and just ruin the whole set of pictures. So the quicker the better all around for the patient. So what is scan time when talking about MRI? Scan time is the length of scan, which in turn is the time it takes to fill up the case space. Factors that affect your scan time are your TR, your phase matrix, and your NEX. The shortest scan time equals the best scan time. It reduces movement and it helps with claustrophobic patients. So the imaging parameters that you can adjust on your MRI scanner to reduce scan time is, number one, you can reduce your TR. This in turn reduces your signal to noise ratio, it increases your T1 weighting, and it decreases the number of slices. Number two, decrease your phase matrix, but that results in a decreased resolution, a decreased signal to noise ratio. So that outcome, I feel like, hurts more than it helps sometimes, but if you have to get your scan time in quickly, then that would be an option. Number three, you can decrease your NEX, which it obviously decreases your signal to noise ratio, and it also gives a increase in a movement artifact, which is not good because normally when you're decreasing your scan time anyways, your patient has already been moving. So that is not a good outcome that you could have. Number four, decrease your slice number. That decreases your scan time, obviously, but it also decreases your signal to noise ratio. Adjusting all of these parameters decrease your signal to noise ratio. So just like the resolution, you have to pick your poison. You have to decide as the MRI technologist which is better for your patient and proceed from there.